And of course, to help us unpack where we are, especially looking at the fight to halt the spread of the coronavirus in Nigeria, well, the National Coordinator, Presidential Task Force on COVID-19, Dr. SANI ALIYU, joins me now in the studio. Thank you so much, Dr. ALIYU, for joining me. I know you have a busy schedule, and quickly, let's start this conversation. I want to start with testing, which, of course, I know that no country in the world has enough test kits. No. And Nigerians have been advised by all sorts of experts. They're saying, you know what, we need to improve our number of testing. But for you being the national coordinator, talk to us about the ratio, looking at our population and the test kits available.
So, Amaka, it's actually not an issue of the ratio of population versus test kits, because remember, if you don't have the symptoms of COVID and you don't have the risk factors, you don't need to have a test. So actually it's an issue of what's our pool, what's the total number of people we've got that we suspect to have COVID infection. The number of laboratories we had a few weeks ago, we had only 5 reference labs. We're now up to 10. A few weeks ago our testing was less than 500. We're now testing well over 1,000. I think the last time we checked it was something like 1,500 or so a day, with 3 labs in Lagos going at full throttle. Some of the labs are operating 24 hours a day with shifts. So we're really escalating the number of tests. Yes, you're quite right. There is a challenge with the test kits. Every country wants it. We currently have a pool of about 30,000 test kits. And yes, that's certainly not enough for a country the size of Nigeria. But we are working very hard, particularly NCDC. I think they've done a brilliant job over the last 1 week in terms of upscaling testing. Okay. And the key thing is to try and, whenever you have a positive, to try and trace the contacts of those positives.
Well, you're watching NEWNIGHT Nigeria here on Arise News. I am Amaka Ude in the nation's capital, Abuja. And of course, Dr. SANI ALIYU, the National Coordinator of the Presidential Task Force on COVID-19, is my guest tonight. And of course, we're taking a look at all things coronavirus and really flattening this curve. And of course, earlier on, you were talking to us about the number of test kits. You spoke about that. As it stands right now, Nigeria only has 30,000 test kits. The reagents that we need for these test kits, really, are we working on producing them in the country? Because I'm meant to understand that that is the main challenge, beyond even having the labs open.
So the test kits themselves are important. They contain primers, which is what we use to amplify and get a result. But we also have a liquid called a viral transport medium. So the viral transport medium was a challenge a few days ago to a week ago, but I understand NIMA are now partnering with another entity to produce this locally. So that will help. But viral transport media alone will not be able to run a test for you. The importance of the viral transport media is we can also use it for doing other tests like LASA. A lot of the PCRs, they use the same medium. So in a way, if we're producing it locally, it makes it cheaper and easier for us. But certainly NCDC have really been upscaling. I'm quite impressed with the number of tests that they are able to do now. I think in the coming weeks, especially as we try and get more equipment in and also make the best use of some of the equipment we have a machine, a gene expert machine, which is used for diagnosis of TB. There are more than 300 of these machines throughout the country. We now have cartridges available in the US that can be used in these machines. But we need to do a lot of work to make sure that they are safe, because we have to have the biosafety side, etc.
Absolutely.
So if we get all that, it means we'll be able to bring tests much closer to the communities that need the test, rather than transporting samples huge distances.
Right. Now you're talking about improving on molecular testing facilities all across the country, but private labs, I know you've spoken about that sometime in the past, but I need to get an update. Will you be willing to work with private labs, in terms of carrying out this test? Because experts have said we need to carry out more tests.
Oh, absolutely, absolutely. I know there's a private lab in Kaduna. I think that's about to be signed off or has been signed off. There's also a private lab in Lagos that I believe could potentially do do the tests. We're all in this together. It doesn't have to be a public lab, or a government-held laboratory. What's important is that it's safe. They have all the biosafety and security issues intact. They also have the quality assurance, i.e. if you get a result, you can rely on the result. They have the right skill set in terms of the people that are doing these tests, so that when the results come, remember, with every coronavirus case, it counts against the country. So we've got to be absolutely certain that a positive is a positive. And it's even more risky if a positive result turns out to be negative, because it means that person will continue to transmit to others. And molecular labs are not easy to set up. They are such highly skilled jobs. You cannot overnight create a molecular lab. They are expensive. They require highly skilled labor.
What if some private individuals are willing to expand their facilities to really help augment the work that the government and the PTF is currently doing in terms of testing?
We are more than amenable to that. Anything that would enable us to get more, to identify where these cases are and to trace them and isolate them will help. Because as I keep on saying, we're all in this together. This is a pandemic that's affecting everybody, whether you're in the government sector or public sector. So it's no longer a case of only our labs can do it. All we're concerned with is to make sure that those results are reliable and the tests are being run in a safe way, so that people are not being exposed unnecessarily to biohazards.
Absolutely. And of course, with every confirmed case that we get in the country, that means more contacts are added to the number of people that we're supposed to follow up on. Indeed. In terms of contact tracing. How much of a challenge is that in terms of trying to get more people who are infected to come to the hospitals?
So that's one of the things I would like to plead to the public. If you have symptoms, please don't stay at home. Don't be afraid. In most instances, people will be fine. 80% of those that get COVID will be fine. The Chinese cohort, the entire cohort, when they did their analysis, 92% fully recovered. And it's much better for you to know if you have coronavirus, if you have symptoms, because it means you can isolate yourself. You don't need you reduce the risk of transmitting it to your household, to your loved ones, to your community, and the easier it will be as well, the faster it will be for us to get on top of the epidemic. We've been chasing a lot of the contacts. NCDC in the last few days, I think, have reached almost about 90% of the contacts of positive cases, which is really good. But at the same time, we have this feeling that there might be a lot more that we are not reaching, maybe because people are worried the moment they get a positive test, we'll have to isolate them. But we'll isolate them in a humane way. We're doing it for the sake of the community and for the sake of the country. And we're not going to put you, it's not a prison, we're not going to put you in a room and lock you up. We'll still consider your rights. The important thing is for you to have a physical barrier between you and the rest of society, so that you can be looked after in a safe way. But at the moment, we do have facilities in Abuja that would allow us, including hotels, for people who don't have symptoms, or have very mild symptoms. Because I strongly believe if you have COVID and you don't need hospitalization, you don't need hospitalization. What you need is just a safe place with supervised accommodation where you can be close to people who can monitor you, so that if in the event that you become more unwell, immediate attention can be given to you.
Absolutely. Well, 91%, according to the DG of the NCDC, is what they've actually, followed up on when it concerns the coronavirus.
Contacts, yeah.
But you know what? That 9% is still a major issue, because we know how contagious the coronavirus is. So in cases where we have slippage like this, are you afraid that chances that community spread might occur from this number that we've not been able to, capture?
Of course, Amaka, it would be great if we can get 100%. But in an exam, if you get 91%, what's that? That's an A. I think 91% is very good for a public health intervention. It really is very good. In fact, it's I would call it excellent. Yes, it would be nice to get that remaining 9%, but remember, even the way we get the contacts, sometimes people do not remember who they have been in touch with, etc. And that's why technology really needs to come in. In Europe and the United States, they're now working with Google and some of the geomapping companies to use mobile phones, so that if somebody has a positive result, they will, using their mobile phone, they will be able to to trace and find out who were the people that the person was close to, and then contact them directly. And that sort of technology in the future will really shape the way epidemics evolve. But for the moment, everything is manual. We'll have to try and rely on people's memory to find out who and who have you seen. So that 91% is still a very good figure compared to what you can have in normal situations.
And of course, you know, since we're talking about the coronavirus, well, we have to consider what's going on in other climes. What are your projections, you know, in terms of flattening the curve? I asked this because, yes, you as well as the task force and other experts have told us prior to even this lockdown that we'll still keep getting more confirmed cases, but we've not seen an exponential outbreak just yet. But your projections,
would
that curve start coming down?
It's difficult. So if you look at a lot of the countries that went into lockdown, it didn't happen within 2 weeks. The change in the numbers didn't happen. The peak didn't really happen within 2 weeks, partly because the incubation period itself could last up to 2 weeks or more. Both China and India, it took them a lot longer to reach the precipice where the numbers start to fall, because we have what we call the transmission, or the R note, which is the number of persons that one infected person will give to. So with coronavirus, one person will give it to an average of 2 to 3 people. So, but if the R note falls below 1, i.e. you're transmitting to less than 1 person, that's when the number of new infections falls. And that can take anything from a few weeks to much longer. What's important is for the lockdown to be effective, for people to really cooperate and keep away from each other. It's been shown from studies that you can get as much as a 45% reduction in transmission rates by locking down. All the other interventions we talk about, like restriction in mass gatherings, like physical distancing, etc., they are all less than 10% reduction in transmission. Lockdown is the only one that gives you such a high figure in terms of dropping. So that's where the evidence is.
So with these numbers we've seen, are we to expect some sort of lockdown? I know it's not your decision; it's the president's decision.
So
really,
we've made our as you saw earlier on, our chair, the SGF, went to visit Mr. President together with some of us, and we briefed him on what we've been doing. He was quite interested in the outcome. He was quite interested in what was going on, and we put forward our discussions, and that's all I can say at the moment. And we'll have to wait for Mr. President to chew over it, and then come up with
all right. Are you looking at what is going on in other climes, especially looking at New York now, which what we're seeing, there are more research being done, and we're seeing that more Africans are dying from the coronavirus in New York. That's African Americans now. So are Africans more susceptible to the coronavirus?
So, a good question. So what do Africans have that other races have less? African Americans are more likely to have diabetes. They are more likely to have hypertension. They are more likely to have cardiovascular disease, just by virtue of our genetic makeup. We're more likely to have that than the Caucasian population. If you have COVID, your risk of mortality is much higher if you have underlying disease. So, and in addition to that as well, the African American community are less wealthy than the Caucasians, and therefore, in terms of access to medical attention, that's more difficult. They don't have medical insurance the way the Caucasian population have. They are relatively deprived, and therefore they're more likely to stay at home when they start getting sick.
So let's contrast that with Nigeria now.
Yes.
Really, in terms of the numbers.
In terms of the numbers, our numbers are still fairly low, and that's true. But then, as we ramp up the tests, it's very likely we will get a lot more positives. But what we hope is all the measures that we put in place will stop that rise, okay? So that we have a sort of flattening, and it will be easier to control, etc. And of course, we remember our demography in terms of our population is very different. So Italy, one of the reasons why they have such a high mortality is because they have so many people above the age of 70, 80. Whereas in Nigeria, we have a youth bulge. And young people tend to have mild disease.